Good day, everyone. My talk today is on the integration of primary health care in the basic medical education curriculum. I am representing the Commission on Higher Education in my capacity as the chair of the Technical Panel for Medicine. The birth of the Universal Healthcare Law, or otherwise known as RA 11223, paved the way to mandate an integrated and comprehensive primary healthcare approach geared towards an equitable, accessible, and cost-effective healthcare services to all Filipinos. This act shall require very critical components, including a competent human resource for health, a whole of government approach, including the Commission on Higher Education, that will address the supply requirements, the Department of Health, which shall address the demand requirements, including implementation, and PRC, responsible for the registration and CPD requirements, and the last component, which is universal healthcare coverage and a strong healthcare delivery system through primary healthcare. The UHC Law aims to establish guidelines for reorientation of the policy, standards, and guidelines for the health professions programs to primary healthcare, install mechanisms to integrate primary healthcare principles into these educational programs and licensure examinations of health professionals, and define the roles of the Commission on Higher Education, the PRC, and the OH on the primary healthcare integration in the curriculum of the health professions program. The following are the general guidelines of the Republic Act. First, to reorient to primary healthcare all curricula and standards of medical and allied health professional and health worker education and training programs. Second, to integrate primary healthcare in the learning outcomes of education and training programs, licensure examinations, and CPD programs for health professions. And third, determine recommended areas of study in public health to be incorporated in the curricula of all medical and allied health professionals and health worker education and training programs. The specific guidelines include promote primary health care as an approach, revisit and review the policy standards and guidelines to include primary healthcare outcomes, faculty development programs, integrate primary healthcare concepts in internship, reflection of primary healthcare outcomes in the table of specifications for the physician licensure examination, student orientation programs in promoting career pathways on primary care and public health, and support to training programs on public health and primary care in public health care facilities. As the regulating agency for higher education, the Commission is poised to do the following in response to the implementation of the UHC Law. First, curriculum revisions integrating public health, primary care in the learning outcomes in health professions education. Design and formulate revised PSGs to integrate learning outcomes in primary healthcare in health professions education. Work towards integrating primary care competencies in internship, immersion, and clerkship. Support faculty development programs in curriculum development and pedagogy towards primary healthcare through trainings and workshops. Advocacy strategies through reorientation towards primary healthcare among higher education institutions, and integrating primary healthcare in recognizing centers of excellence and centers of development for health professions. The implementation of these strategies shall follow the following timeline. For year 2021-2022, there will be reorientation launch and curriculum reviews followed by implementation of the revised internship programs for 2022 and 2023. And finally, inclusion of the primary healthcare table of specifications for the physician licensure examination in 2023. Under this act, the Commission on Higher Education, in coordination with the Department of Health and PRC, is mandated to embrace primary healthcare in the regulation of the program delivery for all health professions education, including medicine. As part of the Technical Panel for Medical Education, allow me to share with you updates on the current position of the Commission towards primary healthcare integration in the MD program. The panel started its discussion sometime during the second quarter of 2021, with DOH and PRC fully represented in the panel. To some extent, primary healthcare concepts and contexts have already been introduced in varying depths and degrees in Philippine medical schools through the family and community medicine and preventive medicine courses. Based on CMO 18 series of 2016, the Commission provides for the minimum curricular contents of the MD program without prejudice to additional courses or topics to be included as deemed important by their respective HEIs. Higher education institutions are allowed to design their curriculum suited to their own contexts and missions, provided they can demonstrate that the same leads to the attainment of the required minimum set of outcomes, albeit by a different route. With this provision, the CHED through the Technical Panel for Medical Education shall provide ample space and latitude to all medical schools in designing their curricula and instructional delivery, integrating the principles of primary health care, provided the school can demonstrate attainment of such learning outcomes. Specific areas that have been discussed include inclusion of primary care practitioner in Article 4, Section 3.3, Program Educational Objectives. Notice that there is a need to further describe the program objectives to include specifically primary care physicians in the roster. A reiteration of the provision in Article 4, Section 4.3, Program Outcomes, which is common to all health-related professions, and that is to demonstrate competence in handling health problems of individuals, families, and communities. Reiteration of the program outcomes specific to MD program in Article 4, Section 4.4, Program Outcomes specific for the Doctor of Medicine program. There are 10 minimum program outcomes, all harmonized with primary health care. And specifying primary health care, public health, primary care in the minimum curricular content located in Article 5, Curriculum, Section 6.3. The Technical Panel for Medical Education stands by its current position that in the spirit of academic freedom as espoused by the Commission on Higher Education, we are encouraging schools to design their own curriculum, integrating the content and context embedded in RA 11223, considering the type of curriculum the HEI is adopting. The Commission on Higher Education is currently crafting a roadmap for the MD program that will guide higher education institutions offering medical programs responsive to the demands of the future, including globalization and addressing the gap in the physician requirements of the country. It is worth noting that the Universal Healthcare Law and primary healthcare principles are included as strategic components for the roadmap. This proposed roadmap shall provide guidance through policies and strategies with emphasis on equity, community empowerment to address the country's health needs. The roadmap likewise prescribes innovation and creativity in addressing the gap in the supply of physicians to meet the country's supply needs through innovative curricular offerings. These strategies will consequently result to a whole gamut of healthcare systems approach. The Commission in the proposed roadmap shall formulate the minimum standards for a medical education that is need-based and community-based. This will produce physicians. This will generate physician professionals who are competent, socially accountable, and responsive to the call for equitable, accessible, and quality healthcare at the community level. The ultimate goal of medical education in the country, therefore, is to facilitate co-creation of a responsible and agile healthcare ecosystem, resulting to better health outcomes through population-based or individual healthcare services. CHED will ensure that its strategies are aligned with the HRH Master Plan 2020-2040 of the Department of Health that will focus on production, workforce development, and other cross-cutting measures. CHED shall provide specific recommendations on student recruitment and upskilling and retooling of faculty, guided by the principles of primary healthcare and social accountability. It shall likewise recommend policies for determining the appropriate student mix that is gender sensitive, with deliberate efforts to recruit and guide based on specific career paths anchored on community needs. Every higher education institution shall exercise its capacity to identify students entering credentials that will support the achievement of universal healthcare's objectives and intentions. There is a need to revisit the curricular content of the medical program, integrating the principles of universal healthcare, primary healthcare, social accountability, immersive teaching learning experiences of students, and improved facilities to produce graduates that are skilled, globally competitive, future-ready, and resilient. There is a compelling need to revolutionize the current thinking of purely individual-based healthcare to include population-based healthcare. Delivery of healthcare that is accessible and equitable as a paradigm must be embraced by all stakeholders of the academe to achieve the identified outcomes. Opportunities for community and school partnerships and interprofessional collaborations, industry and academe linkages must be reflected and incorporated in the curriculum. This will translate to better understanding of community and industry needs, provide a rich research ecosystem, and improve quality of learning experiences for students and faculty. The policy standards and guidelines for the MD program will have to be revisited in order to outline a new curricular map with universal healthcare integration. The new curricular offering should likewise be mindful of the infusion of technology in healthcare delivery and healthcare systems in support to UHC implementation. Flexible learning systems must be enhanced in instructional delivery, as we have learned from the academic disruptions brought about by the pandemic. There will be enhanced community and primary healthcare exposure as part of the academic component of the curriculum. Students should be able to understand the mechanisms and processes in the delivery of healthcare across all levels. Likewise, the CHED shall promote mechanisms to support faculty development programs that will enhance integration of primary healthcare in the different HEIs. In fact, CHED has already scheduled the reorientation rollout in June and has provided funding for the development of primary healthcare curriculum and training for faculty. It is worthy to mention that the TPME wishes to work hand in hand with APMC to fully integrate this mandated program in our respective medical curricula. The legal mandate of the Doktor Para sa Bayan law shall compel all schools to review and strengthen their return service agreement implementation. The IRR is clear about the necessary return service of the scholars, but this shall be viewed in parallel to the return service agreements of students who are non-recipients of scholarships but are enrolled in SUCs with partial government subsidies. This explains why tuition and other fees remain low compared to private higher education institutions. All these strategies shall ensure six-star physician graduates who, together with other health professionals, shall work towards achieving the highest quality of healthcare that is universally accessible and affordable, achieving equity in health for every Filipino. Madamo gid nga salamat.